Welcome back to another episode of Rehab Rebels. Today, I have Susie Gronski. She is a urological PT and sex counselor today. We're going to talk about her journey and a little bit of what it's like behind the scenes with opening up a practice, PT practice, related to urological and sexual counselor background. So welcome to the show, Susie.
Thank you so much for having me, Tanner.
For sure. Let's just go ahead and dive into some of the questions here, gradually getting to where you are today. What made you decide to pursue a rehab profession in the first place?
So my mom was born with spina bifida. She also has a below the knee amputation and prosthetic. And it was in high school when we had career show and tell. I'm not sure if they do those these days anymore, but we had the allied health profession, OTs and PTs present. And it was there where I just felt the passion to empower through intimate relationships, but also to help people get back to doing the things that they find most meaningful in life. And so my mom was my original inspiration, and her modeling of perseverance and resilience with a disability that encouraged me to step into the allied health profession as a physical therapist. That's where my passion first started.
I love that. Very legitimate background story. Yeah. What is the story behind maybe the first sense of awareness that things weren't quite right in the traditional rehab after school setting?
It wasn't too far after I went into corporate world, I would say. I started my practice in the acute care setting and then the inpatient rehab setting as a physical therapist. And in those settings, although very rewarding to work with individuals of all backgrounds, bodies, conditions, issues, and functionalities, the institutionalized framework and the structure in which I had to operate under was just not sustainable, not just for me as a professional, but heads with my values of partnership and collaboration with the patient. There were examples where techs and higher ups in the institution were forcing us really to see patients, even though they were perhaps maybe not appropriate for intensive rehab first, and then who denied, just really didn't want to participate in therapy at that time. There was no autonomy for people. They didn't have a choice. They just had to do what they were told. So it was very structured to focus on productivity, I would say. Productivity, numbers, making money. And I get it from a business perspective that those are important pieces, for sustainability. And also, I think there's a better way to do that while still respecting the autonomy of individuals and their preferences, and also appropriateness for a level of therapy that's very intensive for what they're in for. So I started to really pick up on the fact that there was a huge hierarchical model here that was really emphasizing a for-profit mentality. And that's really not what I went to school for. That's not where my passions were. And it really struck a chord with my values.
I love the word choices there that you used. You just explained it beautifully. It really sounds like you couldn't be the clinician that you wanted to be, or you thought you were going to be able to be.
Right. Absolutely.
What was the specific moment you realized this really wasn't this traditional path and this model that you were working in really wasn't for you? Was there a defining moment that you were, the straw that broke the camel's back, and you knew that you were leaving after that?
Yeah. I bounced around a lot. That's where it led to me opening up my own practice and going into urological care. But backtrack, I had to really, quote, kiss a lot of frogs. And I did. I was in inpatient rehab for about a year, did some PRN work there. Then I went into geriatric care, vestibular care for private practice. That wasn't really working for me. So then I went on to orthopedics for a very short amount of time, because the model of care, again, it was all about see more people, less engagement, an astronomical amount of paperwork and responsibility, but it was really like a mill type setting. And I hate to use that, but it is really what it felt like a conveyor belt. Just see these people, have 3 people on your schedule. And I said, I can't do that. How can I build intimate relationships, establish a therapeutic container to really build trust with this person to help with their recovery, to build resilience, coping skills, etc. I can't be the clinician that I want to be, and I wouldn't want to be treated like that as well as a patient. I don't see that as patient-centered care or patient-first care. So I quickly, again, going from niche practice to niche practice, trying to search for what it was that was really at my heart. And ultimately, I came to the conclusion after doing just PRN work, after I tried the full-time 9 to 5 gig and all of that, and it just wasn't working for me. And I also like flexibility in my life. I really value being able to take breaks when I need to, control my schedule a little bit more so that I can be the best clinician for people and show up in the way that I want to show up with capacity in my tank, with some gas. So in order for me to do that, I then stepped to the PRN role and worked for a day rehab facility. And at that point, I was already dabbling in pelvic therapy. So then I went on to establishing a program as a PRN therapist because they didn't have that in this outpatient facility, which was a hospital institution that had an offsite clinic in another location. But it was there that I started the pelvic health program and then branched off while I was doing that. Can I even say that? I was working on my business on the side. That's reality. You still have to make money. You still have to pay the bills. And as New York grad at the time, student loans are real and they are a limiting factor for a lot of things. And I think really inhibit people from pursuing their dreams because they feel really stuck in a particular model and so forth. So I was blessed and I had the privilege to do the PRN work, pay my bills, and pursue an independent practice. And that's what I did.
Perfect. Preach. Everything that you're saying is, I hear it over and over again with people that have left or wanting to leave. It's just the same. It's like a broken record. So what would you say was at stake if you didn't make this transition?
That's a really good question. What would be at stake? I honestly believe it is my internal set of values of treating people with respect, compassion, fostering healthy notions around building resilience, not feeling that I have to be under pressure or treat an individual like a diagnosis or a number. It just wasn't in me. I really wanted to have the freedom to be able to offer care that I wanted to receive. That's the thing. I want to receive that. And I have been a patient in traditional medical models, in physical therapy. I've been a physical therapy patient before. I've been a neurological patient before. I've been a urological, gynecological patient before. And really, it is not feeling I'm treated just like another number or someone's, bank account. And while I do respect that, and I know that's part of establishing, a business and model of care, but there are ways to treat an individual with compassion, with respect, giving them time, listening, and genuinely being part of that therapeutic container and support and caring. Essentially, you really want to feel cared for. And I just could not, in those traditional models with restrictions and limitations and productivity requirements, I could not thrive as a human being, let alone a professional who wanted to touch people's minds and hearts.
Yeah, your values and your autonomy was being compromised completely. What made you decide to go your own practice route, specifically in this pelvic floor, urological PT, sex counselor direction?
I was really inspired to just drop it all. Really, my husband inspired me because he came home. This is a true story. We just bought a house. It was maybe 6 months where we have this new house, obviously more bills. He was working. He's a BMW buff, car guy, mechanic. He was working as a service advisor for Audi at the time. He just quit. I can't do it. They were also under scrutiny of surveys and selling and all that. And he comes home one night and I quit. I'm just not doing it anymore, and started to work on cars from our garage, right? So I was so inspired. I said, well, if you could do it, I could do it. And I kid you not, it was a week later where I'm going to start my own practice too. So here we are with the new mortgage, diving into our own businesses at the same time. And we did it. We really did it. And it's not we had a ton saved or that we had, a ton of help from our family members. It's just we really were fiscally conscious of if we're going to do this, we have to really cut out a lot of other things and work hard at making this happen. And it did evolve. So I have to give credit to my husband who inspired me to take the leap, to jump and to say, if not now, when? Right. So I found a practice, I found a space close by to my home. And in the beginning, I had to take a small business loan really to renovate the space because you wanted it to be a certain way, especially for urological pelvic care. Those are very personal and sensitive topics. So you want to make sure the environment is welcoming and embracing and all that. So that's how it started and what I was really ultimately inspired to finally take the leap.
For sure. I love that teamwork, your partner and companion, you guys went through something together. That sounds really awesome.
Yeah, thank you.
You mentioned that you guys had to cut out a lot of other things. Could you elaborate a little bit about that and what you mean?
So cooking at home more than eating out, not having cable TV, cutting out anywhere we can trim the fat, so to speak, putting vacations on hold. Just things like that where a lot of money can go really easily, or cutting back on arbitrary spending that really wasn't necessary. So, and that really helped quite a bit. But also, what I think is really important is the mindset. Is not a scarcity mindset, but more of this planting the seed and being persistent and consistent and having faith that it's all going to work out the way it should. And that's not to say that that doesn't come with its own challenges or tears or discouragement, because that does show up even now. But it's that sticking with it and knowing that it's a snowball effect. So in the beginning, it's really hard. And I think it's getting your head, your mindset and your attitude around being a business entrepreneur. It's a completely different mindset. And I think that was the key there too. And having support, so if you don't have a partner or a spouse or any communities of support, right? Mentoring, business masterminds, mentorship groups, that's very important. That's something I wish I did have when I was starting my business, is having a business mentoring, which I didn't. So a lot of the trial and error and fumbling through was just taking the risk to see how it pans out and then making adjustments as you go along. Nothing is permanent. Just try, because you have no idea where that might lead and what other opportunities might present themselves to you.
For sure. Yeah, I completely agree. We actually had a episode on episode 21 where we talk about scarcity mindset and abundant mindset. And this is something you have to adopt if you're going to be a business owner or entrepreneur. And it's about having the autonomy over your life and your schedule and creating this lifestyle of freedom, or lifestyle by design, if you will. So for sure. What would you say were the first signs of traction with this private practice that you were building?
Honestly, I think it was not too far off after I built it, they will come, so to speak, Once you planted the seed and you've mentioned it in the universe, it really did. It was just people found you. However they found you, they did. I used throughout my evolution of my practice, I've tried all sorts of things for marketing, and I can't remember what the reason was in the beginning. But as a physical therapist, I refused to do the traditional physician marketing. In the beginning of my practice, I said, I'm not going to be that person that's going to do in-service and beg, medical doctors to give me referrals. I'm not doing that. What I'm doing is I'm going to reach out to the community. I'm going to reach out and educate the community and stand out as a primary care provider. I am a urological physical therapist. We are all about health promotion, education, function. Pooping, peeing, and sex are vital physiological functions of everyone's, life. And so I use that to say, I'm going to establish a presence within the community and empower individuals to get care for their pelvic and sexual health needs. So that's where I took a different framework, where I grew up around, you have to market to doctors. You market to doctors, that's where your referrals are. That's what was being planted, even in PT school, right? No, I said, I'm not doing that. I was like, that doesn't work. I'm not here to prove myself to anyone. And as the profession itself was changing to be more direct access, I really rode that wave to establish a presence and a voice and advocate really for people, because I do feel that the best health is when you know your own body, when you know where to get help, ask for help, how to ask for help, and that you have options.
For sure. I hear that over and over again too. For individuals that open up their own practice, the best referral model that they have and continue to have is from previous or current clients, because the quality of work that you do will show itself and will end up rippling throughout the community, and word of mouth goes around. And yeah, what would you say are the practical, maybe non-obvious skills that make you a great fit for your work now?
Practical skills, communication skills around difficult conversations. In my practice as a urological physical therapist, we talk about pooping, peeing, and sex. Those are things that are not comfortable for anyone to talk about. It's taboo, it's stigmatized. And as a physical therapist, we didn't have that training of how do you do sexual health intake? How do you ask questions around sex or bladder or bowel function that pertain to someone's activities of daily living, function, and meaning, right? So one of those might be masturbation. Just saying the word masturbation or erection or ejaculation or orgasm. That doesn't just roll off the tongue so easily. So it's those skills of communication, being able to offer a comprehensive medical and sexual health intake. And with that comes listening, active listening skills, being in tune, genuine, receptive in a session, and how to regulate your own feelings that come up within the therapeutic session. We don't talk about feelings. I think that's what's the biggest skill that I have cultivated and acquired from my years of being in the field is how do you navigate your own difficult feelings and emotions in a therapeutic space? How do you navigate when your patient has feelings of anger or shame or grief and loss? Those are skills that are not taught within the curriculum. At least when I went to school, they weren't. They might be different now. But those are the skills that I think are really imperative and crucial if we want to be working with people.
For sure. Also, add that the traditional model really does not allow time for that, processing any of that, or extra time to get through some of those feelings and stuff. I definitely see what you mean.
Yeah, which is another perk of being in private practice. I can have 2 hours for my initial evaluation.
Yeah. What would you say is obvious to you now that maybe you struggled to see in the moment from when you were in the traditional roles as a physical therapist?
The younger PT, the younger me PT, thought that I was not good enough as a clinician from the perspective of I need to take direction from someone else, whether that's physician telling me, on their script, PT eval and treat, here's what you do for it. You have to stay with the script. Just do what everyone else does. Don't question, don't think about it. And even from the perspective of critical thinking, of questioning what we're being taught from assessment to treatment, because in school, certainly you're getting a foundational framework, but questioning the framework. Is this always true? Is this really sounded in science? Is this biologically sensible? When I'm doing an assessment or I'm doing treatment, am I just doing it because someone showed it to me and this is what I learned, but not questioning? Do we have to do it this way? Can we steer away from that? Who's to say? So that I think is the biggest thing that I struggled with because I didn't know any other way until I started to really branch out into my own practice and started to evolve my own model of care that then evolved into this. I can actually be super creative in my sessions. I can add music. I can use all sensory experiences from lighting to heated tables to scents to, just having Play-Doh and arts and crafts with my patients so that we can actually make sense and storyboard if they're in pain. Let's make sense of your experience. How do you express yourself? Let's do that together. Let's sit on the floor. Those are the things that I think when I was a younger PT, I stuck to a script. I stuck to, this is what I was told, and you can't do anything. You got to do the whole high, range of motion, strength in this order, check this, check that. And it's really not like that in real life. It's really not like that. And the more confidence that I gained in myself as a person and gained confidence in my skill and my ability to be more humanistic with people and allow for trial and error and to just allow for that creative process and exploration to occur, that's when my practice evolved to so many opportunities to help people. It wasn't just one way or one manual therapy, move, skill or exercise that helps them. I really, truly believe it's the relationship that you establish with your patient that makes the difference, that helps them with the recovery. We're not here to fix people. I'm not the fixer. And that's what PTs, we fix, we mobilize. But the other stuff is what really matters, or at least is going to enhance and support and help that person thrive, to empower them to not need you anymore.
For sure. That was perfect. What do you love most about your new reality?
I can be my own boss. I can be my own boss. I know probably everyone says that, but I can take time off when I need to. And this isn't, being your own boss isn't all that glamorous. Let me just tell you that. So if everyone out there, whoever's thinking about it is, oh yeah, it's going to be so easy. No, it's not. You're essentially working all the time because you're the admin person. At least for me, for the longest time, I was doing everything. I was the biller. I was the one invoicing. I was the one marketing. I was the one being the clinician. I mean, you did everything. And the best advice I can give folks is right away from the beginning, support yourself with ancillary staff. Have someone to communicate with patients. Have a patient coordinator, a client coordinator. That just freed up so much more of my time. Do the things that you don't want to be doing or that you're spending most time doing, and hand that over. Delegate as much as possible. And the other thing that I love about being, my own boss is that I essentially could cultivate an interdisciplinary, multidisciplinary practice model as a physical therapist. One would think, oh, if I'm a physical therapist and I'm in private practice, I just have to do physical therapy. Well, from one point of view, yes, stay within the purview of your scope of practice and your training. And you don't have to be everything for everyone. And if you're looking to support your patients holistically, comprehensively, why not bring out people who do it better than you? Nutrition therapy, mental health therapy, occupational therapy, sex counseling, all those providers, those practitioners, a diverse team to support your patient in a model of care. Why not? Why can't physical therapists do that?
For sure. Yeah, no, I completely agree. It's once you get outside of this framework of the traditional model and the economy and the jobs that are set out there for us to traditionally do, the creative aspect of what we want to do and where we want to go is pretty much sky's the limit. I love it. I really wish it was more mainstream or even taught in schools. And this is a real avenue that we can do, because it's pretty clear the traditional avenue is just broken and they just care about the bottom line. I mean, it's so common that's why the majority of people are leaving. So what is something that comes to mind that was a real just pain point, a real challenge, a real struggle from, when you started this solo venture to where you are now? And how did you overcome it? What comes to mind? What do you feel like sharing?
That's a big question. I have two things that come to mind. First, we'll start with the growth. There are growing pains when you're trying to expand your practice. As a solopreneur, which is how I started, it was just me. Things were okay and sustainable for some time. But then there came a tipping point of, I can't do this alone. And that was a struggle of, how do I make this work? How do I work on my business versus in my business? Because those are two different things. If my passion is to connect with people, educate people, partner with people, collaborate, help them with their pelvic and sexual wellness, I can't do it all, and I'm not going to be here forever. How do I continue this at a sustainable level? And so that's where I started to really brainstorm. I got to get help. I have to hire on another therapist. I can be a mentor. And so I found myself being in the mentoring space quite a bit from that brainstorming, the opportunity from that challenge. An opportunity arose, the opportunity to create a course. I now teach a course called Sexual Pain, Navigating Care for Cisgendered Men, that allows me to multiply, to help other people do the work, right? I don't just have to be the person and feel like I have to be the only expert in this field. Actually, I can help others do the same. And it was so much more rewarding rather than so focused inward. I got to do it. It's me, all this pressure on my shoulders. No, expand, grow your wings, have other people feel inspired because you're modeling something. You're modeling what it's like to be a female identified practitioner working with pelvises who have penises. And that is something unheard of. What a wonderful exemplar to be, for others, and to help others also do the same with confidence. So from a challenge grew opportunities. So that's one, I think, pain point that I'll say is that the growing pains of when you start to feel the rumble inside, that's time to make a shift and to say, how can I make this bigger than me? And the second one is very personal. I will share it. I think it's worth sharing. It's very personal from the perspective of boundaries. This is boundary work. Boundaries as a female provider working in a predominantly male space. And boundaries are really important to cultivate. What is the engagement of this therapeutic process? How do you want to work with people, and how do you want them to work with you back? And clarity around your boundaries are very important. So I had to do a lot of my own work around what are my boundaries within this work in this field. And I don't mean to say as a female provider and male patients, because this is with any gender and any provider really. But generally, in a female-centric, gynocentric profession that pelvic health therapy is, it really did stem from women's health and women's therapy. And it wasn't until, and it's still lagging behind a significant care gap for men for pelvic and sexual healthcare, especially in pelvic health spaces. So when I stepped into that space, there certainly are social cultural challenges, right? That one has to acknowledge, but also not be afraid of. And I think that's where I found really grew my voice and felt empowered to work with boundaries, like as a female person. Here are my boundaries. This is how I work. Let's be clear, not being afraid, circling back to difficult conversations, to have difficult conversations, to name whatever needs to be named, move forward, work through that with or without your patient. Again, not to be afraid of that. So I think boundary work and clarity around how you want to engage in your practice as a professional, but also as a business owner is really important to get clarity around. And that just comes with practice, and that just comes from doing the work. And it evolves over time. Always. We're always changing.
I love that. And I think, especially in your setting, that's super vital. Just address right at the beginning, because what you're working with and talking about is very sensitive and just very taboo. And I never thought about that, but it totally makes sense what you're talking about. A couple of things I wanted to follow back up on was about your pain points with, starting your own business, your own practice. One of the things that you pointed out was really, if you're going to grow something, eventually you're going to have to figure out how to scale it. And I think there comes a point with every entrepreneur or business owner that's growing is this urge and this feeling of holding on very tightly to what it is you're creating and not wanting to let go of some of it and delegate to other people because of how much you really care and how much you really value what you're doing. And it's just this little baby that you're growing. And it's hard to let somebody else care for that. And it's a struggle finding the right people to work with. It's definitely a challenge, but that is a struggle too that I've gone through with Rehab Rebels, finding the right podcast manager that fits. I mean, I'm on my fourth one and she is awesome. So yeah, for sure, completely relate to that. And I really liked your realization that you're not going to be around forever. We're not going to be here forever. And it's, what are we building? What are we creating? What are we leaving behind? How are we making a positive impact? And immediately I thought also about generational wealth, something to pass on down to our kids. And funny enough, I'm actually going to update the website to where the blog tab, I'm going to move some personal finance things over to the website where you can just click the blog and read some articles I have. And one of them is about generational wealth. And that's, I think, a perk about creating something that's a business that you can pass down or sell or whatever you want to do. But it's something that you can offer and leave your children or family that is outside of the traditional model of the 401k. And I think it's empowering. I think it's super cool.
It totally is great. And unfortunately, I can't speak to the children part, but I don't have any children. However, I have a global community, so I think maybe I can extend that to everyone in the community and all the people who are getting into this profession to feel inspired to do this work and maybe find other opportunities and creativity within that space. So I totally hear you. And who knows, my nephew and niece might watch some of this and are being inspired. And that's cool too, right? So yeah, you just never know. Yeah, thinking bigger. And it's okay to think bigger, really, because all things start in the mind. right? Even a building, the idea has to come from an architect's mind and idea and thinking about it before it goes on paper and then before it actually gets built, right? It all starts with the idea. And I think if we just name it and throw it out in there in the universe, you'd be surprised how it just naturally will end up being your reality one day. It's quite powerful.
I love that. A little bit of the woo-woo. Totally love talking about this stuff because it goes back to at least the bare minimum of a mindset. Basically, what you believe in your mind and what you're telling yourself is the reality that you live in. And that can be a positive thing or that can be a negative thing. And I think it's really empowering affirmations, mindset, mindfulness, acceptance, appreciation, love. There's just a bunch of things that unfortunately are not included in any streamlined education system. And pretty much we're just out here living out life, fumbling around, trying to figure it all out. And these are some big concepts that have really helped me and I feel a lot of other people to create these lifestyles that are just very empowering, very autonomous, and very freeing. What would you say, or what would you share with others who maybe have an itch or they think they want to start a practice, or they're at that edge, they know that the traditional model is not working, and maybe they're bouncing between, do I create my own practice using the license and the skill sets that I have, or should I do something different? What would you advise them, or what advice would you have for them?
The first thing that comes to my mind is just try. Just try. It doesn't have to be complex, right? If you're starting your own practice, you can rent a space from a sublease in an office, perhaps, just, I am, or from partner in a space that might have a referral source. So like a gym, I know a local therapist in town who collaborated with a strength and conditioning gym here in town. And now she has her own business, her own practice, and she's the main PT and she's got a referral source right there. I mean, so, be creative and really just try. You won't lose anything other than maybe time and maybe, some financial stake as well, but keep it simple, is what I tell people. I would say just keep it really simple and just try. Just try. You don't know what it would be or where it could go if you don't even try. And at some point you do have to jump. There's an exercise in acceptance commitment therapy world where you tell people okay, let's just find a chair and let's stand on the chair. And I have them stand up on a chair and I say, okay, I want you to plan to jump. Just plan to jump. And they look at me like, how do I plan to jump? I mean, you either jump or you don't. That's the answer that you get. And that's the whole point. You gotta jump. At some point, you just gotta do it. You can't overthink it. And I get it. Certainly have an outline and have some structure, but there comes a point where you do have to jump and there's just no more planning. And that planning, that incessant planning and need to have everything perfect and everything in the row, et cetera, that's the limitation that we set for ourselves. That's the barrier. That's the inflexibility around the experience that you're about to embark on. It's an experience. Think of it as fun. Think about side hobby, do something PRN if you need, the income. There's so many ways about it. And I think instead of getting discouraged and withdrawal and hang it up, I would say use the adversity and transform it. Transform adversity into your vision.
For sure. Some bullet points here for sure. Analysis. Don't let analysis be paralysis for you. Love to start basic and simple. And I would frame it in the mindset of a couple things here. Do you want to be laying on your deathbed thinking back, what if? Okay. And another thing is what you're really doing is investing in yourself and in your future in a non-traditional way. And so even if it doesn't work out, if you have the mindset and you actually give into this and do this, I'm going to say 99% odds are you're going to get something out of it that's going to likely get you to where you really want to go anyway. So it's just this huge, scary jump thing. And I love the chair model. I never heard of that, but I love the chair model.
It's a great exercise. Or go skydiving. If you're in the front and you've got your skydiving partner strapped to you in the back, there's no backing out. Whether you want it or not, you're going to go. And that was my experience. No, I'm not ready. I'm not doing this. Nope, we're jumping, right? And it's going to be messy. My saliva was all over this poor guy's face, as I'm trying to catch my breath. It was awful. I really did have a lot of your spit on my face. once it was over and you actually were able to catch your breath, it was awesome. Cause then you're like, oh, I can actually just float here and glide. I did it. I wouldn't be able to have this experience if I didn't have the one previously. So it's pretty awesome. And I think if we really, do what you need to do to support yourself throughout that process, you don't have to do it alone. But maybe sometimes we do need to have our skydiving partner strapped to us and say, you're going to do it, whether you like it or not. And I think that was circling back to my husband. He was my skydiving partner. He said, I'm doing this. I'm jumping.
The closest thing that I've been able to relate it to is this clearly applies to a lot of things. We've already talked about the chair. We've talked about skydiving, but it's driving a car. Everybody has to learn how, and you can only read the book so much, and you can only get so far before you actually have to start doing it. And as we all know, when you actually start doing it, that's when you really learn what it's like. I could completely relate to that statement when it's being in physical therapy school and learning versus, okay, you're no longer in physical therapy school and you're a physical therapist now. Huge difference. And it's, okay, I'm actually getting the experience that I need to actually learn how to do this. And there's no other substitution for experience, for sure.
No, the training wheels go off and now you can do all sorts of BMX tricks.
Well, Susie, it's really been a pleasure having you on the show. Thank you so much for taking time and sharing your journey and your story with us.
Thank you so much for having me.
Anytime.